Hey, this is Dr. Myers. Welcome to Utah Valley Medical Spa. We are going to do some facial rejuvenation right now. Robin had a little surgery here, so she's got great cheekbones, but this one is a little bit depressed. So we're going to put a little filler right here just to give a little bit more symmetry where she lost structure, fat, part of the procedure. We had to take that out. Oops. So I'm going to New York in a couple months, and ironically I was just looking at Broadway plays since I don't go to Broadway plays that often. But
So what are you going to go see?
Aladdin.
And are you so excited about it?
Yeah, I think it'll be fun.
I've heard it's amazing.
I gave a list to my wife, and she chose Aladdin or Lion King or Phantom. So.
Well, I've seen 2 of the 3, but I have not seen Aladdin. So I've heard it's
Lion
stellar.
King cool?
It's amazing. Fantastic.
I wonder if we should do Lion King though.
Well,
I hadn't just seen the live action Lion
right?
King. I feel like I
Did you love that movie?
Yeah, it was cool.
We saw that
But
yesterday.
I just saw it a few days ago.
Yeah, go see
turn
Aladdin.
Your head this way.
You should go see Aladdin. It was one of my favorite people that has been in your office who said that it was her favorite Broadway play ever.
Which one?
Coco.
Aladdin?
Yeah.
Well, then I will go watch it.
See? So go see it.
Okay, a little steam poke.
I know when it came to Eccles, I wanted to go see it, but I had to pick and choose. You know, you can't have all the fun in life, right?
Yep.
Pick and choose.
I'll have you hold those there.
When are you going to New York?
2 months.
Okay.
Actually going for a injection conference.
Oh.
From this injector, Dr. Swift, who I really, really like. I think he's awesome. Okay,
Cool.
Go ahead and relax this finger. You can hold a little pressure right there, please. Okay, so I still want to get this out a little bit, so I'm going to go in, all the way down, just a little bit.
It's a good thing you're good at this. I feel like I could take a nap.
Well, yeah. How does it feel?
Wait, I do. No, seriously.
Is it bad?
No.
Yeah, these are, I use one of the small syringes, and really if you talk and don't just perseverate on it, it's actually, though I know Robin's tough.
Oh, let me tell you. I don't
She
know.
is tough. I do know
I think I've gotten a little, wimpier with age.
Is it? Okay, perfect. Okay, tiny bit. There is a nerve down here, but I'm just staying just lateral to it. No slim poke. Okay. Go ahead and look straight at me. And that's getting better. She's got great cheekbones. We're just trying to make this more like that. We might need a tiny bit more. Okay. And we hold pressure, because basically I don't want any bruising.
Thanks. That'll be better for me in California when I'm on the beach this weekend.
That's right. Where are you going?
Newport area.
Newport. Newport's awesome.
Just going to the beach, that's all I know.
Let's look at your chin. Okay, so now let's you do something different. Let me make sure we're done there on the cheek. This one over here.
What would you like?
I'd like. Let's do a cannula with the silk, and then we'll do that around these good lips.
Do you want like a 27.2?
27.2 would be great. Thank you. So that's a cannula. So here I've been using needles, but around here I'm going to be using a cannula. So we're going to be treating these little smile lines and these lines also. This is a really soft filler, so I don't use this tons in this area or here. That one I'll use a different one. Okay, so we're going to put a little numbing. Why don't we turn the lights on? You'll see more.
I'm telling you, you're a champ.
You're being a champ.
This is like
You're doing
Some
awesome.
strobe light. There we
Yeah,
go.
I want the lights on.
you don't like the
Not
strobe light. You didn't want it to be like a
strobe.
dance party.
Yeah, so this is, we call this the port, and she has such a great smile. Now you have to just relax
I'm trying.
because you have a strong, awesome
Yes, I do.
muscles.
Which is why I'm here.
That's why you get those little things. Okay, so go ahead and pull that out. Okay, so this is a blunt instrument. You're doing great. So yeah, around the lips are a little bit tender. There's a little lidocaine in here. But it's certainly way less than having to do multiple needles pokes. Open your mouth a little bit. I find this way less tender.
Yeah, it's actually so much better.
Oh yeah, you've had your
I-
lips injected.
I have.
And it is like murder, she wrote.
Uh-huh.
Whatever
Usually,
happened
at
to
this
Murder, She
point,
Wrote?
I'm crying my eyes
Yeah.
out. I think you can still find a little Angela Lansbury.
I hope so.
I think you just have to search for the right channels.
Little Murder, She Wrote, and
Yeah.
Leave It to Beaver, and
A little,
MASH. And
yeah. All the good stuff. Little Matlock.
Sounds like Jurassic Park down there.
I know,
And
right?
it's probably just like Candy Crush or something.
I think it is actually Jurassic World. Jurassic
Oh,
World, the game.
Oh, is it the game?
Yeah.
Okay.
Yep.
Is it? Aha! I am so proud of my movie knowledge of
I am
music.
too. That's impressive.
Is that Hans Zimmer who did that?
Mm-hmm.
He did like a lot of those scores for those movies.
Mm-hmm.
John Williams and Hans Zimmer. It's probably John Williams. John Williams.
Yeah, it is John Williams. Yeah, I was like, Riker didn't correct it, but he normally would have. I found that interesting.
You know that?
Yes.
does.
You know
I learned
the-
it in second grade, and it's at the end of the year, so now I'm in third grade.
Yeah, I'm confused. You know the directors of music. So who did the music for Star Wars?
I think John Williams did some possibly.
I think you're right. He also did stuff, I think, like Jaws and
Yeah.
Raiders of the Lost Ark.
Yeah, he did do Raiders of the Lost Ark. I remember that because that's the main song that I'm supposed to remember that John Williams sang in second grade.
That's impressive.
There you go.
When I was in second grade, I was playing around in the
You were
dirt.
eating glue.
Yep, and I was eating paste and paper mache. 'Cause it
And
was
look at you now.
delicious. Yeah, look at me now. I'm a
Look at you
doctor.
now.
Because I ate, not because I ate the paper mache, because I made it through my second grade.
That's why.
So look at that, one little entrance point, and really,
incredible.
We don't need to do anything with these great lips. It's all support around the outside, so she doesn't get little straw drinkers lines or smokers lines or perioral rhytids is the technical term for it.
Let's
Okay,
hope-
we're gonna
let's
go to the
hope
other
I'm not
side
smoking.
first. So we're going to use this same port for a little stiffer filler. And okay, I'll take that out. And the other cannula, there we go. Okay.
No, this is like too sugary too. I don't know. This is different.
So this is called the Piriform Fossa. Kind of a a good place to inject as long as it's done safely. There is some risk of not done right. Okay, open your mouth a little bit. Okay, we're not only going to do here, but we're going to do, this is called the Pregel Sulcus. And again, I like this cannula. It's blunt. I can kind of see where the tip is. And again, there's lidocaine in it, so it kind of numbs the area. But all we're trying to do is just support where you've lost collagen and really bony support and even adipose in this area. You can do little lines like I'm doing so that there's no lumps. Or sometimes you can do little deposits. I'm going to put a little bit here just to support this corner of the lip. Okay, now I'm done with that. Okay, go ahead and close your mouth. I just checked for any lumps and it is smooth.
Can you inject some calcium into my teeth while you're at it?
Yes, you want a little calcium? What's going on? You getting a recession?
No, I'm totally kidding.
Yeah.
I just thought, well, I'm here, one-stop shopping.
Yeah. Yeah, I don't wander into the mouth that often.
That's probably good.
Because you have an expert who's
exactly
getting you little pink
braces.
connectors on your sweet braces.
Right.
Rob and I joked because I had Invisalign and she had braces, but she started when I was almost done. So
Totally.
we're both in our 40s and both straightening our teeth. Did you do it
It's
when
totally
you were
worth
younger?
it, right? No, I did not.
I didn't either.
I know, I remember that.
I didn't
So
either.
this is our first time. And look how great your teeth look now.
I know.
Payoff's going to be amazing.
I know. It just took like double the time he said it would take.
That's okay. It's worth it, right?
Yep.
If you want something done right, you go to the expert, and then you
Yeah, that's right. Okay.
put in your time.
So she's got such a great smile that she makes these little curves, and we can't take those out completely, but I want to just help make sure those don't get worse. All right. Now, what's up?
What do you want?
Let's go with some...
Fuller, refine.
You know what? I want to do a little refine. Okay.
What would you like on it? Okay.
So I'm going to just, I see here that it looks a little shallow down with her awesome cheekbone. And this is a pretty curve, but I just don't want it too abrupt. So I'm going to give a little support right here. So I'll take a cannula with the refine, the 27 gauge, please. So we'll do a little of this. And we're going to pop that in right there. So this is refine?
Yes, this is.
Okay, I'll have you pull this out, please. Again, using the cannula whenever I can. And I lost my port. There it is. Okay. So now I'm in here. Go up, and then I'm just going to put little, this is kind of a threading technique, and really I'm just going to try to get this to strengthen and support the tissue so it doesn't get a little wrinkly right around there. A little bit. It's just a little thin layer underneath the skin. Okay, but it doesn't like this angle. Okay. We're going to do all this stuff on the other side also.
How are you doing?
Doing good.
How's that? Is that hurt over here?
No, that's where you could probably put calcium into my molars.
I probably could calcium.
Try not to
Do you
smile.
know, honestly, I have a filler that has calcium hydroxyapatite called Radius, but I don't go to molars. So sorry.
That's okay. I think I like what you're doing.
Yeah.
And now it's documented, so if I don't, I can tell you later.
That's
Didn't
right.
like that one.
Oh, I like that part. Your comment was just not funny enough for that part. Okay. I love
You're
that.
correct.
Okay, so, you know, not much change, just enough to support underneath. And just check it and make sure. Okay. So now, let's go on the other side. Okay, I'm going to maybe turn your head this way. So, I just kind of feel where would just be, get a little bit of a lift here. And there's a little depression right here. I don't want to do it too much. Go right in there. Lift. I'll take another one of those. Thank you. A bit more. Back here a little bit.
It wouldn't be funny if I yelled, ow, fake like something's wrong.
Well, you can tell me the truth. If it's
Totally
ever hurting, let me know.
No.
Because I will, everything we do is just to try to make it so it's...
No, I'm exceptionally amazed. It actually does not feel bad at all.
Yeah, that's because I'm not putting needles in your lips.
Oh, phew. Good thing.
No, I'm just saying that is like a super tender area. Okay.
And you have 2 left.
Of Luma?
Now one after that one.
Okay, turn your head this way fairly. So I really like how that looks. That scar area is looking better. This looks super nice. Actually, I'm going to just stop right there. Now we will go back and do some silk on this side. Okay, and then I'll have the intro, please. Thank you. So what's he doing this summer?
Going on a road trip to Mount Rushmore.
Yeah.
Yeah.
I mean, will you
Had some great
seriously
advice
be up there
from
for
Adrian.
Sturgis?
We will be up there for Sturgis. We're not going to Sturgis. We're going to drive through to
Did you know
Gott.
Sturgis was up there?
We did.
Okay.
It was just kind of one of those weeks where we had time.
Yeah.
It worked itself out that way. So we'll drive through. It'll be a sight to see and some sights not to see, courtesy of Adrian.
Okay. Okay, so this is the rustling silk. Just more for these fine lines around here.
We're going to go try to make an effort to go to Crazy Horse now. Adrian's suggestion as well.
Is it Crazy Horse is cool?
It's very cool. It's
Excited
been
about
going
that.
since like the mid-40s. We've been excavating and trying to finish that.
Here, you know what? I'll take this on with a 30 gauge on top. I'm just going to put a little bit under these lines.
At least I smile, right?
What's that?
They're proof I smile.
I think they're great.
Right?
I think they're great. And all I'm trying to do is just soften them a tiny bit.
I think that's wonderful.
Okay, so this is another little technique. I basically just go under the skin and I'm just putting a little strip there. And then a little tiny strip there. You can turn on the AC. We've put Robin under the lights just enough to...
Hey, I'm not sweating.
Yeah, you're not. Okay, now we'll look over here. And go to this side. And then lastly, we'll do this one here. So you can go up right underneath it, or you can kind of go sideways. Okay, I like that a lot.
Instead of the refine?
No, I'll do the refine right now, and then we'll take some Versa. Okay, go ahead and no.
And that is the last of the refine.
Fine, okay, perfect. So really, besides your lips, Robin, have you had anything else done?
I've done a little cheeks before, and then a little bit in my lines, but it's
Okay.
been forever.
So a little bit in the smile lines, a little bit in your cheeks, and then a little bit in your...
And some little lip before, but I don't
Yeah.
have anything in my face at all right now.
Okay.
Well, now I do. With all sorts
Yeah.
of stuff.
Those are years ago then?
It's been a long time.
Hmm.
I've never had anything down where you're putting it right now.
Yeah, this is... I'd say this is a little bit more...
A refined technique.
A little bit more refined technique.
It's a good thing.
Because you don't want someone to look like a chipmunk, but we just don't want a dramatic difference
The hollow,
between the hollow.
That's perfect, I guess.
You want it to be more subtle instead of you look a little sallow, or
I look like I don't eat nearly as much as I do.
yeah, it just is a little more dramatic. Doesn't look as healthy. Healthy. That's a better
There
word.
you go.
Okay, so we're good there. We have done, let's see, 1,
You're good if you
2, 3, 4. We've done 4 fillers, because a lot of people are like,
Amazing.
oh, 4 fillers. But look how just little subtle stuff it's done to help. It's helped on the cheeks. It's just helped with this area down here, help with these little lines. It's helped. See how this place is a little bit better than this one, has a little more shadow? Just real subtle stuff that no one would know that you had fillers, but yet it just keeps you looking good for your age.
I love it.
You have really good
Bring it on.
cheekbones.
Okay, you ready?
Love my
take
lips,
that
love my
one.
cheeks. Never gonna complain about those.
Okay, little. Okay, so this is our Versa. It's a little stiffer filler. Not as stiff as Voluma. Okay.
And that's the last of the Versa as well.
Okay. Thank you.
You're welcome.
Now all these areas can be treated with a needle, but you've noticed the only needle I've done is in her cheeks with the Voluma, because you really have to get it deep. You can't get down that deep with a cannula. And I think that's huge. Even if this takes a tiny bit longer, she has less pain, there's more smoothness, there's less risk, there's less bruising, just a ton of different benefits if someone develops skill with the cannula. So I'm going clear over here to get this little crease under the chin, and I know that one hurts. You're doing good. I can just see where I'm at, and I know. Okay, good. And lastly, I do want to get up and put some support right under the... Okay.
Do you want the velour?
The velour? Yeah, let's see if there's anything else we want to do. This has been marvelous.
Awesome.
Yeah, I'll show you. There's still a tiny bit on this side. So I'm going to take a
This
very
is velour?
similar product, velour, and this is the technique with the needle. So again, I do use a little small needle. I drop it on. I just put a little bit under the skin there. A tiny bit more. Perfect. Massage that in. I love it. So that's a lot better there.
No sleeping on my face tonight.
I mean, I want
Don't
you to
wanna,
sleep.
like,
I
even
want you
that,
to
you know.
sleep. So yeah, let's talk about that.
Yeah.
So a lot of people say, hey, when I have fillers, you know, I can't sleep on your face. Listen, technically you could get a tiny bit of change with that. For the most part, they're staying there.
Okay.
And I think it's more important for you to sleep.
Okay.
So,
So although it's malleable right now, when I'm
Yeah.
sleeping tonight, it should be pretty good.
I don't think you move that much. I think it's good for the next couple days to not and let it
Yeah.
kind of set in place. But I'm just saying, in the long run, you know, to never sleep on your face to avoid. I'd rather you sleep. So
Don't
if you're
worry, I
not
will.
sleeping good on your back and you're sleeping way better on your side, then
Do
worry
that.
more about good sleep
I'll just
than
pay you to
about.
fill those wrinkles in later.
Yes, that is my
I'll just
point.
keep paying you.
Well, not the paying part. I'm talking about I want you to sleep. I
Okay.
think good
I like
sleep is better than like proper, you know, proper sleeping or whatever. Sounds like an English way of sleeping. Proper sleeping.
Do it. I just told you can't retire till I die.
Done.
And that's
Well,
half
wait,
the
that's a
velour.
long time.
That's a
No.
long time. That is. You're
I will
right.
be retired
Okay,
before
fine.
you die.
I probably can have wrinkles when I get a little older, right?
Right. Okay. Okay, so you can see one last thing is her temples. They just look a little bit, you know, really has good full features here, but they just look a little bit lack of support, lack of collagen, lack of, you know, fatty, and a little bit almost bony. So just by helping that, instead of losing the eyebrow into shadows, I'll show you a little technique to help that out. This is her temple crust. This is her bony orbit of the eye. I want to go up an inch over and one there, and then I look for this vein. I can see it. So I'm just going to go just to the side of it. I go down. And I'm on bone, and I don't want to give her a headache. I just want to just help put a little bit of this in. Now I'm going to need some more of this. Hey, Adrian,
Yes, sir.
do you have more of this?
I have one more syringe. Would you like it?
Was this one full?
You said straight. Yeah.
So I always hold pressure here for about 1 minute.
Well, for a while, I was getting called Chelsea for like a month straight.
By me?
No, by some of the new MAs.
Oh, I'm like,
Because we had a Chelsea at that time, too.
Yeah.
There was just too many.
Cuz, and yeah.
It's like when you call your kids every name but theirs,
Yeah.
Yeah.
That's what I told Dr. Myers today. I'm used to it. It's no big deal.
right?
You need a little bit more of that. Okay.
They actually probably
Try
could
to
have
get
napped.
more.
This is impressive.
Okay, that's a little bit here. Super slow down. Very deep. Hold pressure like that. Okay. Amazing. So that, I like that. That's just good, subtle stuff. Let's hold pressure there for 2 minutes. Robin.
Yes.
Way to go.
Hey, I'm just going to say the only thing to up your game would be a foot massage while this is going.
Yeah.